So we're talking about cultural food patterns. So I want you to turn to page in your basics book. I want you to turn to oops, I'm sorry, page 198. And we'll start with Orthodox Jewish. Never milk and meat in the same meal. In fact, if they eat meat, they have to wait until 6 hours after to have milk. So you don't ever want to give them milk and meat on the same meal tray. Meat has to be kosher, so it has to be killed in a certain way for them to be able to eat it, if they're Orthodox Jewish. Two meals contain Usually 2 meals contain dairy products and 1 meal contains meat. That's usually the way they do their meals. Separate utensils are used for meat and milk dishes. They have separate pots and pans for them too. That's the way they usually cook. Meat has to be kosher, which means it has to be drained of blood. They're prohibited from eating pork, birds of prey, fish without fins or scales, like shellfish, like oysters, crabs, or lobsters. So they're not allowed to eat those. Muslims, their dietary laws are based on the teachings of the Quran. They're not allowed to eat pork, or they're not allowed to drink alcohol. So no fermented fruits or vegetables, no alcohol. The foods with special value are things like figs, dates, olives, honey, milk, and buttermilk. They believe in humane slaughter of animals for meat. During Ramadan, they do a fasting, 30 days of fasting during daylight hours. Although when somebody is sick, they are considered to be allowed to not take part in that, but a lot of people will want to if they can. Hispanic people, basic food is beans, chili peppers, corn, small amounts of meat and eggs. Puerto Rican, starchy vegetables, fruits, rice, beans, coffee, plantain, and green bananas play a large part in the diet. Native Americans, the foods often have religious and social significance. Diet includes meats, breads, in some areas blue corn, eggs, vegetables, potatoes, tomatoes, and fruit. African Americans, minimal milk in the diet, leafy greens, turnips, collards, mustard greens. Pork is very common in the diet. French Americans, strong, flavored, and spicy food. That's really Cajun influence. Frequently contains seafood like crawfish. Food preparation starts with what's called a roux. It's made from heating oil, and then you put flour into it. And then they use vegetables and seafood that's added. That's what the basis is for things like jambalaya and things like that. So they use that base. Chinese, they use the freshest foods available. But with Asian foods, they usually use a lot of sodium. So you may see a lot of high sodium in the diet. A lot of soy sauce and oyster sauce. They cook at high temperatures in a wok, with a small amount of fat and liquid. Meat in small amounts, and eggs and soybean products are used for protein. As far as Japanese, rice, soy sauce, tea, a lot of seafood. They also use a lot of raw fish or fish that's been treated with vinegar or rice wines for that's been like chemically cooked. Italian, Southeast Asian. Rice is a basic food eaten in separate rice bowls. They may eat soups, fresh fruits and vegetables, and stir frying is common. Italian, bread and pastas are basic foods. Cheese is frequently used in cooking. And food is seasoned with spices like wine, garlic, herbs, and olive oil. For Greek, bread with every meal. Cheeses like feta are used for cooking. Lamb and fish are very frequent. Fruits for dessert, eggs in main dishes, but not a breakfast food in Greek culture. As far as for age, infants, human milk is ideal food for the first 6 to 12 months, but no cow's milk until they're 12 months old. Solids should be introduced only one at a time for a 2-week period. And we do that because we want to find out if they're allergic to any foods. We usually start with like a rice cereal, and then fruits, vegetables, potatoes, meats, eggs, orange juice. No honey during the first year of life, and that's because of the possibility of botulism. As for toddlers, teeth, as they get their teeth, they need fewer calories, and then we allow children to choose foods as they get older and make their own choices. For preschoolers and school age, protein and calcium are needed. Needs are high, but preschoolers and school age may be more picky, and they often don't like their foods to touch. So giving them a plate that has the foods not touching is always a good thing for them. For adolescents, more calories for when they're having growth spurts, and females will require more iron when they start their menses because of the blood loss. For adults and the elderly, calories again need to be limited. A balanced diet with food pyramid is very important. As people become elderly, their calorie requirements decrease. And in pregnancy, it's recommended that there's a weight gain of 24 to 28 pounds. Folic acid is needed for the development of the baby. Required 300 calories a day during pregnancy and 500 calories a day during lactation. And iron supplements are recommended. For patients with TPN, for dextrose solutions greater than 10% should be administered through a central line, and you should not piggyback into a TPN line. If lipids are being infused, it has to have a fine bacterial filter, and remember, hyperglycemia is a frequent complication along with infection. We have to monitor carefully for infection because of all that glucose. IV filter and tubing has to be changed every 24 hours to prevent that infection. Food safety, just checking for odor, signs of spoilage, risky packages, clean your hands, foods, plates, and utensils properly. Separate raw meats from everything else. You don't want to cross-contaminate with raw meats, raw chicken. Always cook foods to their proper temperatures. Chickens to the highest temperature, 180. Always chill food promptly, and do not use uncooked meat after 2 days. Throw away anything older than 2 hours unrefrigerated, uncooked longer than 2 days, uneaten longer than 4 days, and obvious signs of spoilage. As far as tube feedings, remember that we always elevate the head of the bed 30 to 90 degrees before it's feeding and 30 to 60 minutes after feeding. Keep the head of the bed elevated at least 30 degrees at all times. If feeding is continuous, then their head of the bed always has to be elevated. We always listen to the bowel sounds for a patient with tube feeding every 8 hours, and always check tube placement by aspirating stomach contents and checking for pH before each feeding. Record I&O, and if nausea occurs, we always stop the feeding and call the MD. Please review the Kaplan Nutrition Review slides at the end of the slideshow that is on your Moodle, and make sure that you read all of your questions carefully. There is a quiz that will be on your Moodle that is entitled Nutrition Review Study Quiz. Please go and do your quiz on your Moodle, and then review in your Kaplan Basics book. Do your remediation on your focus reviews for nutrition, and be sure that you watch the video for therapeutic diets that is included in the remediation with your focus review for your Kaplan nutrition. And good luck on your Kaplan nutrition.